We have in the last 24 hours tested 2,567 samples, out of which some 52 people have tested positive for COVID-19. This now brings the total to 1,161 persons who now tested positive. The cumulative tests so far are at a high of 55,074. In terms of the spread, Nairobi has a higher number this time with 23, Mombasa with 7, Busia with 7, and I would like to urge the government of Busia County to become extra vigilant and extra careful because it is a border point. There are a lot of truck drivers in Busia, and you can see that the figures in that county are beginning to grow. On our part, the Ministry of Health, we will take all measures possible and necessary to support Busia County so that the figures in Busia do not continue to grow. The national government takes this opportunity to recognize the great work that county governments are doing in response to COVID-19 pandemic. As I have repeatedly said, this is a disease that cannot be tackled by one level of government. This fight requires the entire government and the whole society approach. The collaboration and cooperation between the two levels of government and the people of Kenya has been and has contributed to the gains we have made to fight this pandemic. The national government will continue to work very closely with the county governments and other agencies to strengthen the country's capacity to mitigate against the COVID-19 disease. Today's visit to Machakos County is part of an elaborate plan being implemented by the ministry to inspect the levels of preparedness at the county level and to ascertain the type of support needed. This is important in helping the Ministry of Health to provide support based on the needs per county. When we started this fight against coronavirus, our initial focus was on capacity building at various levels. Emphasis was placed on escalating human resources as well as infrastructural capacities. In collaboration with county governments, the ministry rolled out a training of trainers program, and to date, at least 7 healthcare workers per county have been trained. This will now cascade downwards so that all personnel in all counties will have been trained. Today, we can proudly say that over 11,000 healthcare workers across all counties have gone through training. Additionally, the national government has committed to support county governments recruit 5,000 community support workers in order to enhance their human resource capacity and in order also to create opportunities for our young people, particularly those in the health working sector. The restrictions have largely contributed to the low numbers of counties like Machakos, the restrictions and cessation of movement that we have made across the counties as is necessary. For instance, the one in Nairobi and metropolitan area. This is, however, not to say that Machakos and other counties are completely safe. On the contrary, just like the governor has said, you are at risk, particularly because you are in a transport corridor. And as much as the government will do whatever it can, there will still be errant personnel, errant people, who will come and intrude, break the law, and will be amongst you and possibly infect you. I am told of this story of this truck driver or somebody who got a lift with a truck driver here in Machakos, came up to Kathiani to see the sister, and you know the story. You know what happened. So I am just saying that let's not think that because Machakos has only got 3 cases so far, that you are safe. I want to tell you to keep it up. Keep up the distances, keep up the hygiene levels, keep up the masks, and that way we might just be able to stay there. To keep the numbers this low, the residents are urged to continue adhering to the containment measures and also exercise the Nyumba Kumi initiative of policing. If you see somebody in your area who has been to Mombasa lately, Nairobi and other places, you should raise the alarm. I am not saying that you start lynching anybody or beating them up. No. But just raise the alarm. Let us know so that we are able to contain the situation. We are no longer going to import PPEs anymore. Our local manufacturers are now able to produce better quality than those that we were importing before. The issue of shortage will soon be a thing of the past.
It is important to note that healthcare is not a luxury. Proper and efficient healthcare is a right to many of our people. And that is the essence of devolution. That is why counties have been given the powers and the abilities to be able to treat our people. And we are proud that in Machakos we've concentrated on treating our people. I was very happy to take the minister to the Machakos Cancer Center, where we treat people free of charge, regardless of how much it is, under the Universal Healthcare Program that was initiated cleverly by our President Uhuru Kenyatta. We want to thank the partnership that we've had with the national government that has allowed us to succeed. Corona is real. We have washed hands many times today. We have sanitized. Even nafikiri waziri umenotice chakula is tasting different nowadays. Kwa sababu watu wanaoga mkono sana. Kwa hivyo iko sawa kabisa. Because we are now cleaner and a healthier nation. What I can say is that as a country we support you. We support what the national government is doing. And I urge my people of Machakos to take this as a statement that we are on the highway from Mombasa. We don't allow trucks to stop in Machakos for long. Only 30 minutes, na ziendelee. We stopped temporarily the distribution of alcohol. Kwa sababu waziri, pombe ilikuwa inakuja, inasimama nje ya baa imefungwa, lakini stock zinaletwa kila siku. Stock inaletwa kila siku. Tukaona kuna shida. So we are planning to relax it so that now alcohol vehicles can come, but not to close the bars so that other people can have their drinks as we really keep distance. All I can ask is, please, in the spirit of fighting coronavirus, kama mtu si bibi yako tafadhali na bwana yako, kaa kando na yeye kidogo. Naona tumekaribiana sana. This is now against the regulations. Na tutaki kuvunja sheria ya Machakos. Kwa hivyo tusonge nyuma kidogo na tusonge kando kidogo.
You know the other day we went to Fakasave? But the 6.7.
The temperature, the heartbeat of the patient.